live in a medical dictatorship. So we practically built a fortress, to fend off any health reform that's coming from the federal level. What is your advice for California parents and the medical freedom community? What are we supposed to do now?
Well, California is a very difficult state to live in. I live in
It is,
California. I live
yeah.
in Redding, California, which
Hmm.
is far north. And what I would uh, really suggest is that you get to know your medical community well within your region, and you do a ton of homework. Getting a medical exemption for vaccination, which is our only option in California, is nearly impossible, to the point where I have told people, they say, should I move out of state? And I say, yes, you should move out of state. I mean, there are specific reasons why even my family lives in California, regarding my son. And if services were ever tied to vaccination status, which I don't think that they would be because of the Intellectual Disability Education Act, I don't think that they can require vaccination in any state for getting services. In fact, even in California, if you have an IEP, if your child has an individualized education plan because they're receiving special education services, they do not have to be vaccinated. Many school districts will hide that fact, or they may not know that fact. But if your son or daughter has an IEP, then they do not have to be vaccinated to go to a California school. Many people do not know that. But honestly, if it wasn't for extenuating circumstances, I don't even think my family would live in California.
Can people in California see a doctor outside of state for a medical exemption?
They cannot get a medical exemption out of state. It has to be somebody within the state of California.
That's
I,
licensed.
and for the school district to honor that. Now there are lots of different things that I always encourage people to contact me directly, to contact Children's Health Defense directly, given your situation, given your extenuating circumstance, even in California, because there are medical providers. Again, it's the same situation. It is open season on medical providers that provide medical exemptions in the state of California. In fact, as a part of the state policy and state law, if any one practitioner gives a certain number of medical exemptions, they're automatically investigated by the medical board.